For many, opioids have a powerful grip on those who use them. Many start out innocently, taking a prescription given to them by their doctor to help their pain level, but quickly become dependent on the drug. It's a slippery slope. Before many realize it, they've made a jump to heroin, an illegal opioid that's easy to get on the streets. Nevada leaders and first responders are working hard to get ahead of this problem, but they have a long road ahead. I talked to one former addict who explains why that opioid high is hard to beat.
Like a warm, cozy blanket wrapped up, and you're safe and secure, and you feel like you're floating on air, and you can control the world. That's how you feel. Well, for me, and that's my experience, that's how I felt.
Danny refuses to sugarcoat anything when it comes to opioid addiction.
At 19 is when I first tried opiates, and it made me feel like I was on top of the world, and I knew right then and there that was like my best friend.
But that best friend quickly turned on her. What started out as a little bit of recreational use turned into much, much more.
At first, it was just on the weekends. I promised myself that I would only do it on the weekends, and then it became an every other day thing, and then it became just an everyday thing.
And getting her fix became increasingly difficult, putting her in situations she'd never thought she'd be in.
Probably sleeping with people that I didn't want to. Completely lowering my standards and dancing, and that's my truth though, because that's where it goes.
Even losing custody of her 2 children.
Honestly, I couldn't take care of them, and I knew family members that could. So that was when I decided that that was the best choice for them.
Danny's life today looks much different. She's been clean for more than 3 years, has found a strong support system in girlfriend Irma, and has rebuilt a relationship with her family. But Danny says she's just the tip of the iceberg. According to the Centers for Disease Control, opioids killed more than 42,000 people in 2016, more than any year on record. 40% of all opioid overdose deaths involved a prescription. In Nevada, opioid overdose deaths have steadily increased. In 2014, there were 545 overdose deaths. 2015 had 619 deaths, and 2016 had 665 overdose deaths. But let's break that down even more. Here in Clark County, we've actually seen some small improvements. In 2011, we had 334 opioid-related overdoses. 5 years later, in 2016, that number was at 286.
87% of the fatal overdoses are attributed to opioid prescriptions, about 11% to heroin, and 7% to fentanyl.
Dr. Michael Johnson, Director of Community Health for the Southern Nevada Health District, is one of many trying to figure out the best way to get a handle on this scary epidemic.
I think people think because a doctor prescribed a particular pain medication, it's okay to continue this indefinitely, and that's just not the case.
One of the biggest priorities right now is making sure doctors are following new prescribing guidelines in Nevada. For example, new patients will be limited to a 14-day initial prescription for opioid pain medicines. If they need more, doctors will have to perform a series of evaluations as well as use the prescription drug monitoring program to make sure patients aren't doctor shopping, steps that weren't always taken in the past.
As opposed to being more routine and regimented in practice, I think it was done haphazardly. Some physicians did, some physicians didn't so much. So I think that's been part of the problem.
But while lawmakers tackle the prescription pill problem, there's another issue that can't be ignored. Heroin use in recent years is up from 11% to 15%.
There are cases where individuals have switched from opioid prescriptions to heroin because it's easier to get on the street, particularly with these new restrictions being in place, as it has been to get a prescription for this. So we see many people moving, to purchasing on the street.
Survival from an opiate overdose really takes a village.
City of Las Vegas Medical Director Dr. David Slattery and his team at Las Vegas Fire and Rescue see overdoses every day. And instead of watching many succumb to their overdose, they have a chance to save their life with this. It's called naloxone, or Narcan.
We know that when someone takes an overdose of opiates, they start getting sleepy, decreased level of consciousness, and then their breathing slows and then stops. And that's when they go into a rest and die. And naloxone, Narcan, reverses that in about 15 to 30 seconds.
EMS has been using it for years when they answer calls for possible overdosing.
We see about 600 calls a year, so 2 to 3 a day that we're reversing an opiate overdose.
And now he, along with other community leaders, are training groups all over on how to properly administer Narcan, which comes in a nasal spray or injectable forms and is available at your local pharmacy.
And then you just spray it up there, and that's it. And it's absorbed right into the bloodstream.
Groups like court marshals, nightclub bouncers, and hotel security all want training.
We wouldn't hold off doing CPR on an overdose just because they're an overdose. I don't think giving naloxone empowers anything. It pulls them off that cliff, it saves their life, and allow the specialist on the back end to start working on that addiction. But at least we have a human being that's alive again.
And a second chance at life, like Danny got, may be all they need to make a change.
It wasn't honestly until one day that I honestly tried to end my life, and I woke up and I was mad and that I wasn't dead, and I had a choice either to go right or left, and I chose to go right. Sometimes I want to pinch myself because I'm like, I can't believe this is my life. It's hard though. I'm not gonna lie that it's a cakewalk and that it's easy, because I've gone through a lot of ups and downs and there's a lot of struggles, but I just know, and I keep in the center of my mind, that using heroin or drinking alcohol or using meth or whatever the choice is at that moment is not gonna fix my circumstances.
She says a higher power now helps her get through and reminds her of what's important in life.
When it comes to helping people beat their addictions, leaders really believe it's about meeting people where they are. An example of that is the Southern Nevada Harm Reduction Alliance, which aims to reduce drug-related stigma, overdoses, and the harmful effects of drugs. Now, there is a lot of hope that these overdose numbers are going to go down. We have to remember that the prescription guidelines only took effect early this year, so it's going to be really interesting to see where those numbers go.
And they say trying to kick the heroin addiction is almost impossible. Not impossible, but very, very difficult.
Very difficult.
Yes.
It is very difficult.